Tinoshow. Here I am in Nigeria with these beautiful, intelligent personalities within the health department. I'm sure you remembered we were speaking to the registrar, Mr. Augustine Abiske, earlier on, and I did say that we're still going to continue this conversation. So this is another way of broadening our knowledge within the health service. I'd like to know the role of environmental officers in Nigeria. What exactly are they doing? They recruit day by day, or they recruit monthly, or even seasonally. But what are the improvements that have happened, and what are the problems still affecting Nigeria within the health service? Let me tell you about Tinoshow. Tinoshow is a talk show that facilitates participation between Africans in diaspora and Africans at home. Tinoshow believes that every individual in diaspora, every African in diaspora, should come back home and develop their country. I believe we all should work together and make an impact. So today, I will be discussing the situation and the role of health officer in Nigeria. I think that the founder of Tinoshow, I do have 4 groups in my in each of my forum. The groups are health, which is where this gentleman and lady will be more valuable for us, and we will be valuable to them too. The second one is legal. The third one is infrastructure, and the fourth group is poverty elevation. Now today, what I like to do is to get enlightened, and my colleagues back in London and overseas can get enlightened and know how we can come in to support the health environmental system in Nigeria. So, gentlemen and ladies, please introduce yourselves.
I'm Dr. Mrs. Agnes Olojoba from Delta State. I'm an environmental health officer at the Ministry of Health, Delta State.
Nefiok Moses. I work with Federal Ministry of Health and the National President, Society for Environmental Health.
I'm Gabriel Mbong. I work with the National Malaria and Vector Control Division, Department of Public Health, Federal Ministry of Health.
At the moment, could you tell us, what are you doing here? I can see some papers and things like that.
Actually, I work with the Ministry of Health, Delta State, but I'm posted to the Delta State School of Health Technology, as a lecturer.
Okay.
So we lecture. What we are doing here currently is to mark scripts of students that did a national council exam concerning this environmental health profession. They did the exam December last year, so we are marking their scripts.
Okay.
In other words, the purpose is to actually screen them into the profession with this exam. So as many of them that are successful, they will be licensed to practice as an environmental health in Nigeria.
When I was talking to Mr. Abiske some few minutes ago, I remember that he did say that he enlightened us on how we need some more candidates and some more recruits to join the health, environmental organization, because one health officer is appointed to oversee 7,000 population.
Well, the already joining is 8,000 population.
8,000. So one health officer should support 8,000 population, and you're not having enough today. So through this, exams and things, if they are qualified, what do you think that would be? Is that something good?
It is expected that it will be employed by the government in different tiers, local government, state, federal, as environmental health practitioners. But actually the problem we are facing now is lack of manpower. It's like labor is too much, I don't understand. So recently, employment of graduates from the different fields, more especially in this public health aspect, is limited. So actually I want to state that we don't have enough hands, enough manpower to really run this public health activities, more especially in the schools, in the ministries, just like that.
Thank you so much. Mr. Moses, are you listening to our conversation? I see you're busy somewhere there. So, what do you think?
Well, maybe I go back to where you started, the deplorable state of environmental situation in Nigeria, which impacts negatively on health. This has been duly, as a result of the negligence of environmental health services in the country. Like you notice, before now, the pre-colonial era and the post-colonial era, environmental health was given a pride of place. The European governors brought sanitary inspection of
Sanitary inspection.
of premises.
And that is what the problem is today. You go to some place, you have to cover your nose, hold your breath, because it stinks terribly.
After they left, all the gains made were neglected, and so it disappeared. And so over the years, every government have toiled with this process. Not until 2002, when provisional status was accorded a provisional service area, with the act that established this council, which we are talking about, which are privileged to be the pioneer member. Now, the council is like running a race to restructure this whole system. But like Dr. Lojova has mentioned, the manpower is not enough.
No.
Because in some states, as I'm talking to you, there is not even a single environmental health officer.
Really?
In this country.
In this country?
Yes.
That is disastrous.
It drifts from north to south.
Oh dear.
Yeah. For instance, I don't want to mention a particular state.
Yes.
But there's a state in the north that doesn't have a single one.
Oh dear.
And but down south, maybe southwest, you have relative high number. But this is still not, there is no state in Nigeria that have met the minimum required as recommended by WHO.
And that, sorry sir, and that explains the state of the country today within the health sector.
Definitely, because
We
what
understand why.
you had during this
We understand why.
colonial era was that the population was small, and then there were enough people to
The whole place was so
almost
clean.
like, in quote, police the environment.
Yes.
To ensure that the educated people, refuse were well managed and things moved smoothly. But since like government overlook this aspect, thing becomes so deplorable, and it is at the state we are. So the council is trying to bring the environmental health consciousness into the system and ensure that things are done properly. The council's main function is to regulate the practice.
Okay.
And by that, regulating the practice means the professionals are well trained, and then they are licensed to practice
Like
in the various schools of health technology
Madam has just
and
explained.
universities.
Yeah.
But even when you go to most of these training institutions,
It's empty.
like we are talking about the same network, because the institutions are owned by government. They are not equipped to impart
right.
adequate skill to these professionals. And sometimes, like the outcome of the exam being marked here, when we sit down and
It's
analyze,
appalling.
it's appalling because the exam, this certifying exam, is supposed to see the level of skill the student has acquired. The student cannot acquire an empty skill that is not there. For instance, most of the schools don't have environmental health lab. This is a specialized lab with specialized equipment for training, apart from the academic lab, like Olojova has mentioned, physics, chemistry, biological labs. The environmental health lab is a specialized lab, which will have specialized equipment like noise meter, pH value meters, all other equipment that's supposed to enable environmental health practitioners to practice.
Yes.
Indeed, we have been really
Deprived.
begging people can support our school.
Are they supporting?
With basic, nobody is coming, because you see what happened is that in Nigeria, the whole system is run by government in the public sector. So for you to talk about people coming to support, it means that it is where government has identified interest. That interest is not yet there. Government does not seem to really feel that environmental health
Is a priority.
a priority that should be brought to the national agenda. Now, aside from training, the practitioners too need this equipment to work, and they are very costly. For you to buy the simple handheld equipment, you need thousands of naira.
Okay.
And since it's not provided by the employer, and then the practitioners cannot afford, it means that they just work with whatever is
They have,
available.
yeah.
So that's another area. Like Cheryl said, the practitioner will need retraining constantly.
And to be reskilled.
And so we are in the process of establishing an institute that will provide short courses for those who are in the
That's
field.
the basic, that's the
And
foundation.
even this,
A very good foundation.
this
I
institute,
think.
when it is established, we will need equipment.
You need qualified trainers.
We need trainers.
You need lecturers and facilities.
What your organization can do to us is if we can identify some equipment.
It's called Tinoshow.
Tinoshow can do.
Tinoshow.
Tinoshow can do
Tinoshow.
is to provide, if you can source equipment, environmental health equipment, that can either to some school or maybe pilot schools, because you can't cover all the schools. There are about 27 schools.
Okay.
Then your diaspora program can help source trainers.
Okay.
Can either come in short
We have so many of them
basis.
that would like to come in. Some people will
Because
ask you, where can we help?
we are running in the university the Bachelor of Science, Master's degree.
Yes.
Most of the school can't start the program because there is no teacher. Apparently, it's a fallout from the previous neglect, because if you did not train, it means you can't have trainers.
I know.
So this is another area we really need some assistance if there is. So there are a lot that can be done. And then of course your show can also help to bring about the environmental health consciousness in Nigeria. If we have a sustained public enlightenment program, either like a jingle that keep reminding people, because since we are few, we can't be going to we can't be going to the house where we used to, because people are not there to do